1. Which of the following best describes the primary role of the IBHRE certified professional? A. Diagnose cardiovascular diseases independently. B. Program and manage cardiac implantable electronic devices, CIEs. C. Prescribe antiarrhythmic medications. D. Conduct invasive cardiac procedures. 2. When teaching a patient with a newly implanted pacemaker, which adult learning principle is most important? A. Use only medical terminology to ensure accuracy. B. Involve the patient actively in their learning process. C. Focus exclusively on providing written handouts. D. Rely solely on verbal explanations. 3. Which evaluation method is most appropriate to assess a trainee's competence in CIE programming? A. Multiple choice exam only. B. Direct observation with a skills checklist. C. Self-reflection survey. D. Peer discussion forum. 4. Which statement best aligns with regulatory compliance in CE management? A. Device interrogation results may be shared freely without patient consent. B. All device programming changes must be documented according to institutional policies. C. Regulatory guidelines are optional recommendations. D. Training documentation is not necessary for experienced staff. 5. During mentoring, the most effective strategy for building a trainee's confidence is to A. Allow the trainee to perform tasks without guidance from the start. B. Provide clear feedback and gradually increase task complexity. C. Criticize errors immediately without context. D. Focus only on theoretical knowledge. 6. The key parameter to check during a pacemaker follow-up is A. Blood pressure. B. Battery status and lead integrity. C. Liver enzyme levels. D. Respiratory rate. 7. Which learning strategy enhances knowledge retention in adult learners? A. Passive listening to lectures only. B. Active problem solving and case-based scenarios. C. Memorizing without application. Reading material once without practice. 8. A trainee demonstrates consistent errors in lead placement during CIE simulation. The best mentoring approach is allowing repetition until mastery without feedback. B. Providing corrective guidance and demonstration. Moving on to a new skill immediately. D. Ignoring the errors to preserve confidence. 9. When programming an ICD for a patient with recurrent ventricular tachycardia, the clinician must primarily consider A. Patient dietary habits. B. Tachycardia detection rate and therapy zones. C. Age of the patient only. D. Hospital administrative schedules. 10. Which is a core component of effective curriculum development for IBE training? A. Random selection of topics. B. Alignment with competencies and certification objectives. C. Focus solely on theoretical content. D. Exclusion of practical skills. 11. What is the most effective communication technique when instructing a patient about device alarms? A. Use technical jargon to ensure precision. B. Demonstrate alarm scenarios and discuss actions clearly. C. Provide a brochure only. D. Avoid discussing potential complications. 12. A trainee is struggling with ECG interpretation. Which evaluation method is most appropriate? A. Written exam without feedback. B. Simulation with real-time guidance and assessment. C. Group lecture attendance only. D. Peer discussion without observation. 13. Documentation of device programming changes must include A. Patient initials and date only. B. Complete device settings, rationale, and clinician signature. C. General comments without specifics. D. Only verbal confirmation. 14. During mentorship, the best approach to foster critical thinking is to A. Provide all answers immediately. B. Ask open-ended questions to guide problem solving. C. Limit discussion to lecture notes. Focus only on repetitive tasks. 15. Which of the following is a contraindication for certain pacemaker programming settings? A. History of atrial fibrillation, mild seasonal allergies, short-term insomnia. D. Controlled hypertension. 16. In adult learning, feedback is most effective when it is A. Delayed until the end of the training program, B. Specific, timely, and constructive, C. Vague to avoid offense, focused only on mistakes. 17. Which of the following accurately describes an appropriate lead parameter to monitor? Aid impedance, body mass index, serum creatinine, hemoglobin levels. 18. When conducting a patient follow-up, the IBHRE certified professional should A. Focus solely on device data, B. Integrate device data with clinical symptoms and patient feedback, C. Rely only on patient self-report, D. Delegate follow-up entirely to administrative staff. 19. Which principle is most critical for curriculum evaluation in cied training? A. Only trainee satisfaction, B. Assessment of knowledge, skills, and behavioral outcomes, C. Trainee attendance only, D. Quantity of teaching materials distributed, an ICD patient experiences inappropriate shocks. The first step is to A. Immediately replace the device, B. Review device logs and programming settings, C. Ignore unless symptoms persist, D. Prescribe additional medications without evaluation. 21. Which factor is most critical when selecting a pacing mode for a patient with sinus node dysfunction? A. Patient's lifestyle and activity level, B. Manufacturer of the device only, C. Color of the device, D. Hospital administrative preference. 22. Which documentation practice supports regulatory compliance? A. Document only unusual events, B. Maintain complete, accurate, and timely records of all device management activities, C. Rely on memory for documentation, D. Summarize weekly instead of per session. 23. During mentorship, how can a trainer assess readiness for independent CIED programming? A. Observation of real-world tasks with graded responsibility, B. Asking trainees if they feel ready, C. Providing only written exams, D. Ignoring performance and focusing on theory. 24. When teaching a patient about lifestyle modifications post-implant, the most important consideration is A. Cultural relevance and patient engagement, B. Length of educational handout only, C. Avoiding interactive discussion, D. Focus exclusively on technical device details. 25. A trainee fails to recognize oversensing on a pacemaker ECG. The mentor should A. Correct the mistake immediately with explanation, B. Let the mistake pass unnoticed, C. Move on to unrelated topics, D. Punish the trainee to enforce attention. 26. Which principle is most important in adult learning theory? A. Adults learn best through passive observation, B. Adults bring prior experience that should be integrated into learning, C. Repetition is unnecessary for adults, D. Adults do not benefit from real-life application. 27. Which action is essential before making changes to device programming? A. Document only if changes are complex, B. Verify patient consent and review clinical indications, C. Change settings immediately without review, D. Only consult peers without documentation. 28. A trainee demonstrates competency in programming but struggles with patient communication. The mentoring focus should be A. Ignored since technical skills are sufficient, B. Targeted communication training and role-playing scenarios, C. Repeated technical practice, D. Assigning additional readings only. 29. Which monitoring parameter is crucial in detecting lead failure? A. Lead impedance trends, B. Heart rate only, C. Blood pressure variability, serum electrolytes. 30. When evaluating an educational program for IBHRE certification, the key metric is A. Number of handouts distributed. B. Achievement of defined learning outcomes and competencies. C. Instructor satisfaction only. D. Length of lecture time. 31. The most effective strategy for teaching a patient to recognize pacemaker malfunctions is A. Demonstrate device alerts and simulate scenarios. B. Provide a 50-page manual. C. Verbally describe potential malfunctions only. D. Avoid discussion to reduce anxiety. 32. A patient presents with syncope and a previously implanted ICD. The first priority is A. Reprogram the device immediately. B. Assess for arrhythmia or device malfunction. C. Schedule routine follow-up. D. Refer to psychiatry. 33. Adult learners best retain information when learning is A. Contextual, problem-based, and relevant to real-life scenarios. B. Purely memorization of facts. C. Repetitive lectures only. D. Unstructured and random. 34. In regulatory compliance, which action is mandatory? A. Maintain documentation of all device programming, patient education, and follow-ups. B. Keep records only if adverse events occur. C. Document verbally without formal records. D. Avoid documentation to save time. 35. During mentorship, providing opportunities for reflective practice helps A. Improve trainee critical thinking and self-awareness. B. Focus solely on procedural speed. C. Reduce the need for supervision entirely. D. Limit discussion to technical content. 36. Which device parameter is most indicative of appropriate sensing function? A. P wave and R wave amplitudes. B. Heart rate variability only. C. Blood pressure readings. Patient age. 37. The best method to evaluate trainee performance in CIE interrogation is A. Direct observation with structured assessment. Asking trainees to self-report. C. Reviewing lecture attendance. D. Checking exam scores only. 38. When mentoring a trainee on patient communication, the most effective approach is A. Role-playing patient scenarios with feedback. B. Reading text-heavy guidelines aloud. C. Avoiding patient interaction. D. Focusing only on technical terminology.